This program contains true stories of rescues.
It's First Aid with Kelly Kinkaid.
Hello and welcome to First Aid. I'm your host, Kelly Kinkaid, and today we're going to talk about an important topic, health insurance. Do you have health insurance? Yes or no? If you don't, there's still time to enroll. And today I want to welcome a special guest, Beth Lynk, CMS Director of Communications and Senior Advisor to the Administrator for External Affairs. Welcome, Beth. How are you today?
Thank you so much, Kelly. Thanks for having me. Happy New Year.
Same to you. First of all, please tell me, what is CMS? What department do you work with?
Absolutely. So the Center for Medicaid and Medicare Services is at the Department of Health and Human Services and serves as the key provider of health insurance coverage for 144 million people across the country. So that covers anyone who's getting their health insurance through Medicare, through Medicaid, or through the Affordable Care Act's health insurance marketplaces. And that's what we're talking about today, because there's an open enrollment period right now for healthcare.gov.
Right. And I said there's still time. What is the deadline for enrolling in health insurance?
Absolutely. Well, there is still time, but the deadline is fast approaching. So folks have until January 15th to sign up for health insurance coverage on healthcare.gov. And the good news is that health insurance coverage, thanks to the American Rescue Plan that the president signed into law in 2021, health insurance coverage is more affordable and accessible than ever. And we're actually seeing that about more than 90% of people who've already signed up for coverage, that's 13.6 million people across the country that have signed up for coverage already, have been getting financial assistance on their health insurance coverage. And we also know that thanks to the American Rescue Plan, about 4 in 5 people are able to find health insurance plans for $10 or less per month. So it's a really good time to check out your options if you're uninsured, and a really good time to kind of plan for your healthcare needs for the year ahead.
Let me start by saying it's great that more Americans are signing up, but we still have a percentage that haven't. And the stats say like nearly 30 million people still haven't signed up for health insurance. Why do you think, what is the disconnect, and what programs have you all kind of put out leading up to the deadline?
Yeah, so health insurance coverage is a priority for the Biden-Harris administration, for the CMS administrator, Chiquita Brooks-LaSure, and for everyone here working at CMS. We are really focused on making sure that folks are able to get the healthcare coverage that they need. And I think one of the things we've seen during the pandemic is just how critical it is to have the peace of mind that health insurance coverage brings, whether you need coverage to cover routine treatment and care for diabetes, or if you have an illness like COVID, or get hurt or break your arm. Having health insurance coverage means that doesn't become a really catastrophic financial event for you and your family. So in terms of what we've been doing, this year, in 2021, rather, the president opened a special enrollment period for the health insurance marketplace. And we actually saw record enrollment during that period of time. Coupled with the open enrollment period, more than 4.6 million people that were previously uninsured or didn't have health coverage got signed up for healthcare coverage in 2021. That's really significant. And as you noted, we do have a ways to go, and we're really working to do that. And part of the way we do that is by making health insurance affordable and accessible to people, and then getting the word out. And that's one of the things that my team and all of us here at CMS are really focused on, to make sure that folks know that not only is health insurance important, it's also in reach for folks across the country in a new way because of actions like the American Rescue Plan that have made it more affordable.
Yeah, and I speak on there was a time for myself when I wasn't I had health insurance and I had it and the prices went up. And I know you say the 4 out of 5 people. What about the people who aren't able to qualify for the financial aid? Because I will speak for myself. I felt like it was becoming a rent. I was paying almost the same amount as rent, and mine like jumped up. Are there as far as qualifying for financial help, are there people, hardworking people who are working 40 hours who are making a living? How about those people? Because I feel like that was my cry, like, wow, this is really hard, but I want to be insured. Are there other programs for like a rolling scale or something of that magnitude?
Yeah. Well, I mean, first, let me be clear. I think um, in terms of the monthly payment that you pay for health insurance coverage varies based on where you live, your age, your family size, and kind of your income and your personal needs for kind of healthcare in terms of what you're looking for a plan. In terms of how often do you think you're going to go to the doctor? What kind of what are you looking for in a health insurance plan? That's why I think, particularly as we're looking at the new year, and you're kind of making resolutions around the new year, it's really a great time to go into healthcare.gov, check out your options, shop around, and see what might best meet your needs. I will say, and I think your experience is one that many can resonate with. In the past, is that sometimes health insurance coverage is felt out of reach or felt too expensive. That's one of the reasons we're really encouraging people to come into healthcare.gov and take a second look, because things have changed, and plans are more affordable than they've been before. And there's actually more options available now than there have been before as well. So, you may, choose a potentially a more expensive plan than like a $10 plan, because you want more coverage. But one, you can rest assured knowing that, the plans on healthcare.gov are comprehensive. They cover things like behavioral health services, to emergency care visits, to your basic routine preventative services, to your prescription drugs, and all of that. But two, that there might be plans available that are available at a lower cost than you might expect. So we're really encouraging folks to kind of come in and take a look, and see what's available to them. On your question about, the financial assistance, will I qualify? The other great thing that the American Rescue Plan did was make it so that more people qualify for that financial assistance that I mentioned. So it's based on your income. So you'll put that in when you're looking and shopping for plans, and then it'll show kind of how much financial assistance that will be available to you. And so I think, really it's a great opportunity for folks to go in, check out your options, given the changes that have occurred.
And I also wanted just to speak about also in your state, there's a lot of local help
Yeah.
uh, as well. So it's just a point of an easy thing. You have a computer, you have a phone, just log on to healthcare.gov. Is that the correct website?
That's right, and I'm so glad you mentioned the local help that's available. We also, if you want to talk to someone on the phone, we have a call center that runs 24/7. It's 1-800-318-2596.
Okay.
And then we also have expanded the amount of local assistance that's available. So it's actually quadrupled across the country, meaning that most counties have what we call a navigator or a sister in your local community that you can talk to about your options, and kind of talk through what might work best for you. And so you can go to healthcare.gov /local help, to get that assistance. And actually, I'm sorry, it's localhelp.healthcare.gov. That's localhelp.healthcare.gov to get that assistance.
And we're in a new world, new times, and I think what's so important, health is wealth. And I really love this administration too, because I get so many texts. Have you registered? Have you enrolled? And I think it's so important. And I really appreciate your time coming to talk, because we got some more people to reach out here. And I want to talk about, I love being happy, but I love saying I have joy. I'm very joyful. And you all have some campaigns speaking about joy. And I just wanted you to share because we still have some days left and some people who need some joy, who need to enroll. Let's talk about your campaigns.
Yes, thank you so much. We're really excited about it. I think, as you mentioned, we've got work to do to get the word out about the importance of health insurance coverage and to get the word out about how affordable it is, and really to make sure that we're getting folks enrolled in coverage. And a key focus for the administration, for CMS, has been ensuring that folks that historically have been and underinsured, like the Black community, have the opportunity to take advantage of these resources and health insurance coverage. And so to advance health equity and really to engage the community, we launched a campaign called Take Care of Your Joy that really focuses on bringing awareness to the open enrollment season, but focuses on the joy that healthcare coverage, or feeling that peace of mind of knowing that you're able to take care of you and your family, frees up and that space for the joy that life brings with our families. And we know that there's a lot of trauma and ingrained kind of hesitancy around healthcare in our community. And one of the things we wanted to do with this campaign is really focus on the joy that taking care of your health can bring. One of the things our administrator Chiquita Brooks-LaSure, who's the first Black woman to run CMS, it says all the time, is that it's important that we take care of our health, that we focus on getting engaged. And one of the things we can all do in the new year is make sure we're going to the doctor and prioritizing our health to ensure that we're able to take care of ourselves, take care of our families. I think that's becoming even more important with the pandemic, as we're seeing all of the accompanying challenges that we've been having to deal with.
Yeah, and before we leave, Beth, I want you to speak to that person who's still apprehensive. They're on the fence. And as much as we can say, listen, all you need to do is log on, look at this and that, just to sign up to see. What would you say to them as far as like, you still got time and to be a part of, be insured?
Yeah. So you still have time to get health insurance coverage on healthcare.gov. We want to help you and make it as easy as possible for you to get that health insurance coverage. A couple things to know is that health insurance coverage is more affordable than it's been in before. It's more accessible to you and helps available to navigate this process. We know it can be complicated and potentially confusing, and we're here for you. So you can go to healthcare.gov. There, if you want to call us, you're welcome to call us at the call center, or you can talk to someone locally in your community to talk through your options. But I think as we open this new year, it's a really great opportunity for us all to invest in our health and invest in ourselves by pursuing health insurance coverage.
Yes, and can you the local telephone number? Can you say that number one more time?
Absolutely. So our call center number is 1-800-318-2596. And you can call us 24/7. We're available in 200 languages if you need that language support.
Well, I want to thank you for coming and getting to these people. I know we're going to sign some more people up. We're going to get this number down lowered and have just some really more positive numbers of more people insured, because health is wealth. Thank you, Beth Lynk. This is First Aid. I'm Kelly Kinkaid, and we'll talk to you soon.